champ. Bismillah. Yeah, ready, miss. Hi, Dr. Oli, how are you doing? Yes, is my sister present?
Yes, she's present.
You've got the way to sit up. Sit up. Hi, Kakumanda.
Hi.
How are you? I see you flying up. God bless you, Doctor. How are you doing?
Good morning.
Hi, Doctor. What's your name?
How are you?
I'm good, Doctor. I hope you got some good reports about me.
Depends on what's good.
I've managed to understand why everybody's care plan is different,
Okay.
and the needs of everybody is different within the establishment.
Okay.
Obviously, the benzos was prescribed, but I just wanted to prove that I can go without benzos, yeah?
Okay.
And even the lorazepam, that doing the promethazine, I put my hand on the table, hand on the heart, yeah?
Sorry?
The promethazine, I used to make lean. Basically, I used to take a tablet, put it here, doc, yeah? 50 milligram, and I'd crush it with paint in my pen, and I'd put it in Coke, well, a whole back Coke, and I'd, do you know what I'm trying to say, doc?
Yeah.
But I've stopped doing that, I've given my Coke bottle in,
Okay.
and I've not had no promethazine for, I think, about 50 hours now.
Okay.
But I'm sleeping good at night, doc.
Okay.
Yeah, I'm very sorry about breaking the rules.
Which of the rules?
The promethazine bit, doc. And that's the only rules I've broken, yeah.
Okay. I mean, for us, it's about knowing why the medication was prescribed for you.
Yeah, I appreciate that.
And engaging with your team if you don't want it or if you feel there needs to be a change about it.
Yeah.
Not refusing it, okay?
Yeah, I do apologise. But yeah, doc, do you know in terms of the lorazepam, I was having some withdrawal symptoms yesterday about 6 o'clock. The Satinda gave me 2 milligram of it. I didn't have nothing last night to sleep.
What do you mean withdrawals?
As in like my head's hurting and my body was hurting.
Okay, and what are you discussing now?
Physical dependency, doc.
On
Lorazepam, benzos, yeah.
Okay. How long have you been taking it for?
Benzos, I was taking it fully. It's on the notes, doc, yeah?
Okay.
And then after that, I think like, I've started weaning myself off it. So I had, when Abu Bakr was on, not last night, the night before, I had at 11:30, I had 2 milligrams. And then all day yesterday, I had 2 milligrams at 6.
Okay.
And today I've had nothing, doc.
So let's just check how this medication is prescribed.
Yeah, I'm not going to smoke, doc.
So let's just check how it's prescribed for you and then we can
Amend it, yeah.
talk through it.
Yeah, appreciate it, doctor. I'm very sorry, Dr. Olu, for my immature behaviour prior to my last admission. And even this admission.
Don't worry, let's just focus on the end. Yeah, now.
You've got to be so smart, doctor. You've been Turkey.
Yeah, now.
Well, my teeth, yeah, sorry, you know, I know I'm undercutting you, doc. But my teeth are really to a dentist. The course does not work and these are becoming loose now. But I've not got no pain or no sensitivity because of that. Yeah, please don't. I might need my antibiotics because my gums are bleeding and they're inflamed. Yeah, I am. So I've not had it this morning because I was.
You need to use it for
a sustained period. Yeah, thank you, Dr. Conley.
Mouthwash as
Yeah, I've been swallowing it, I'm sorry.
Don't swallow it.
Yeah, do you know why? Do you know why I say this? Do you know your bacteria in your mouth? You've got to get into your immune system and it'll cure itself. But that's where I think it's stuff anyway.
Well, put it out.
I will do that. So I'm not alcoholic or anything, and I've got no drug misuse or something. Do you get what I'm trying to say? I'm not dependent on anything.
Yeah.
Apart from aripiprazole.
The mouthwash will kill bacteria in the gums.
Yeah.
Helps soothe the inflammation.
Oh,
Spit it out. You want to swallow all that?
Oh, I do.
So I'm looking at your
Prescription.
medication right now. I think you were started on lorazepam a week ago.
No, nitrazepam. I'm not took it once though.
Yeah, sorry, hold on. So the lorazepam was prescribed to you.
A long time ago. Throughout the whole section.
Okay, so I'm just looking at last week until now, you've had it just 5 times out of possible 14 times.
Yeah, and the nitrazepam I don't want stock.
So why are you not taking the lorazepam?
And the nitrazepam. I don't need it though. Sleep well. Do you know, I used to get insomnia. Do you know why the insomnia was doc? Because I was using the promethazine. I even mixed some lorazepam in it once, doc. Do you know what happens, doc? Let's say, if people leave the coat still in their room, because when you put promethazine in it causes a carbonation of the methyl, yeah? And it's like a cocaine effect, doc.
So you've been using the promethazine, which is...
I've stopped using it. I don't want it anymore, my God.
But the last time you used it was...
When I made lean, doc.
21.
Yeah, so that's 3 days, 72.
3 days ago. Yeah. But I mean, is there as required?
I don't want it, doc. Take it off, please, because I don't want to abuse it.
So what we do is...
But what to do, doc? Like, make people sit with you, because if the promethazine is coated in a blue coat, yeah?
Okay.
That's an indicator if they secreted it on their teeth and stuff. Do you know what I'm trying to say? Because obviously when I put it in paper, doc, the promethazine, it leaves a blue mark, it leaves blue marks on the teeth. But obviously, obviously it's formulated to be digested past your stomach, isn't it?
Yeah.
So obviously, when you crush it, powders it straight away because it's a solid thing, doc.
So there are other things that happen in the world that we're not very happy about.
And these situations, I've explained that to you, doc. And even in terms of my rudeness to the staff members, I've apologized therapeutically, doc. And I'm very sorry for that behavior, doc.
But my concern is we're having lots of these incidents. It's not just Handy. Okay?
Oh, with Lee?
There's another patient there.
Lee, yes. No, I never swore to nobody, doc. I'm not racist and I'm not discriminative, yeah?
You're calling them names.
No, I've never done that, doc. On my daughter's life.
The reports we have.
No, sorry, doc. The patient, even yesterday, Lee come up to me and goes, I threatened him, remember you was there, miss? And I go, Lee, I've never said nothing to you. So, like patients sometimes, like, and you have situations, remember when I go to him, kept calling me a Teletubby, Tinky Winky, Dipstick, Lulu Poo, and then I de-escalated from there and I went to watch Emmanuel play pool with Lee. He comes up to me and starts nattering my head again, the same thing. So all I did was like move my shoulder, but I didn't hurt him, though. And I scratched on his arm, he did himself, so I'll scratch. But even on this place, boss, like PQ, obviously psychiatric intensive care unit, isn't it? And I think I found my place, doc. In terms of obviously as a system, obviously the doctors obviously as medical not concern and medical responsibility as a clinician. And obviously I see that now. And I see why your job is so demanding, mentally and physically. So sometimes you lot take work home with you, even like doctors that have to do urology, for example. It's very difficult job because my missus had open effect to me, and obviously that's when you keep your stomach out, your intestines out. Do you know what I'm trying to say?
I get what you're trying to say, but I want to come back.
Yeah, so all I'm saying is, I appreciate your time and efforts with me, yeah?
Okay.
And moving forward, I don't want to leave PQ. My depot is due on the 28th, but as a clinician, you can give it to me today. And obviously, and I want some Section 17 leave, if possible. I don't want to go grounds. I can get grounds as well if you give it to me, doc. But I've got no bail conditions left at home.
Okay.
And my mum and...
on that bail condition, so what are
No, it's erased.
It's not erased.
My dad told me, though.
So what we understand is that your family have applied for it to leave there, and the police are waiting for approval.
No, my dad told me yesterday that it's been diminished.
Okay. So I'm just telling you that we had this discussion before you came.
Oh, sorry, doc.
We wanted to clarify the
Bail conditions,
what we have from police is that your family have applied, but they're waiting for the approval.
Oh, yeah, I get it now. I get it.
So we don't have the approval.
So anytime, so if my kids, obviously, can I get my visits back again, doc? What happened last time, doc? I'm sorry.
Why were you?
Yeah, because my mate come in, innit? Now Sangia. And obviously I was a bit irate, and you remember that first time when I seen you here, Doc, and I was
Don't
very...
worry, just go straight to the point.
No, not last time, this time when I seen you and I was like, Doc, you know, do you get what I'm trying to say?
Yeah.
I was very intimidating, I'm being intimidating stuff. But then when they told me to come on board, I did come on board. And that, I'm very sorry for that,
So
Doc.
what I heard, was that you held the stage.
Sorry?
That you held the person that visited you held it on stage.
No, that's wrong, Doc.
So what happened?
He come, and I left his keys and his card, I put accidentally in my bag. But then before he went, I gave it to him, I didn't hold nobody hostage, Doc. Because I go, you can go if you want to go in and out, he kept coming in and out with Brighton can confirm it.
Okay.
Megan come in, Megan's not here today, yeah?
Okay.
And she makes, sometimes, you know, like Megan's got her own team, occupational therapy, you know. So I'll go to the kitchen with her, and sometimes, like, Fiona's here today, but it's very busy, so we're not going to the gym today. She promised me tomorrow, but I've stopped punching my bag in my room. It's not my bag, my mattress. It's crazy, it's not fair on the patient hearing a banging sound, yeah?
So what we're talking about is you requested for your visits.
Yeah, please, if you can, please, Doc. I'm sorry about that.
I'm asking you now, why was it stopped?
Yeah, because obviously my mates come in, and I go to him, look, I just want to go out with you for community leave, if they can give it to me. But obviously, I told him what to say and stuff, and what to do. But I didn't hold nobody hostage, Doc. He was free to leave in and out.
Okay.
He come in and out, you can check the CCTV. It was my last visit, you can check on the system. It's all encrypted in it. Not in it, sorry, but something else.
So we will get additional information.
Yeah, please, Doc. You know, like Megan, she's lovely, don't get me wrong. But sometimes I think she's a bit biased, like discriminative. That's my personal opinion. Like, as in, like, last time, you know, like some patients, like Leo Bates, he kept calling me a nonce and oh, you fucking wanker on white supremacy and stuff. I'm not being racist, yeah? And like even Raymond last time, he's talking about white supremacy, and you can ask the colour stuff if you don't believe me, yeah? Not colour's a bad word in the black stuff, or whatever you want to say, but yeah? But I swear, I've never done nothing wrong. I'm a good-hearted person.
So what you said is that one of the time you go to.
Yeah, Megan come in and she made false allegations against me.
So what happened? That's what I'm trying to find out.
Oh, basically, my mate Sandy will come in for a visit, yeah? And obviously I'll go to him, look, I want a community leave, and then Dr. Brown was here, and I go, Dr. Brown, he wants to talk to you, because it was after Monday ward round. Yeah, it happened Monday ward round, last week it was.
Okay.
And then basically, she didn't come to see him, and he just wanted to discharge me, because he's down, I got accommodation to go to, Doc.
He wants to discharge you.
Yeah, basically, yeah, because I can go live with him. But I don't want to go live with anybody at the moment. I want to go back home to my wife, the mother of my kids. Because I've got a daughter at home, Doc. And my daughter's my life, and you know that by now, Doc.
Okay.
Boys will be boys, my dad says.
Okay.
But obviously my bail conditions or whatever, Doc, yeah? But if you give me some community leave, my dad, I've got restriction against my mum, innit? But my brother lives next door, 247 Amar Shafiq.
Okay.
And I can go to his house and go see my kids, and that's them to come back, Doc.
So I've heard you, but let's just hear feedback from very.
I'm not going to make Doc, so
Feedback from.
be honest, Mr. Pickney. Please. Apart from Lee's incident yesterday, everything's been blessed in this. It's up to you, Sorry, Doc. Sorry, miss.
Yeah, I have something unchangeable. Sometimes he keeps using his phone very loud, sometimes his voice very loud, the community area.
Sorry, Doc.
I have a few things to do with that patient, especially
Lee.
yeah. I tried to calm him down, but he wasn't really listening to me. And before me, he was verbally attacking the patient. So it was not really.
What happened is, you know, I was calm, I come out my room, Doc, yeah? I was playing pool or whatever. They were playing pool, me and Jason played pool. And then after that, I sat down, and Lee comes up to me with a staff member, and the staff member goes, "Why are you threatening Lee for?" And I'm not going to talk to Lee today. Yesterday, this is Doc, yeah? And so obviously it's about 6 o'clock to check the cameras. Yeah, obviously when this incident was reported to the young lady, yeah? And then obviously I will be, I've not said nothing to you. What's happened, Doc, yeah? There's some of these items he says got missing, yeah? Obviously your neobates, that's why they say you shouldn't trade in here, isn't it? So I've been trading with Neil, and I didn't know they were these, but I'm not giving them back to him. Do you know why, Doc? Because I paid money for them. To Neil.
So Neil.
Yeah, Neil Bates, who's gone to an acute ward, and he's been calling me nonce, calling me this, calling me that. And one more thing about Neil, Doc, yeah? Let me finish about Neil, because I know patients, I talk to patients, isn't it? You know Neil, just Neil for example, do you know who, he got called by predator hunters, yeah? And he died a 12-year-old girl, he knew she was 12, 13, whatever. Neil, who's 55 or 56, he's had sexual intercourse with a young girl, a lot younger than him, like 16, 17, 15 maybe. I'll leave it at that now.
Where was that? Where did you get this information?
From Neil and Luke himself.
Okay.
From
So,
what
what we're trying to do here, and I was mentioning that we focus on your care.
Yeah, I appreciate that, Doc.
Our patients' care.
Sorry, Doc.
What we asked you is that you wanted to tell us about what happened between yourself and Lee.
Yeah, that's what I just told you, Doc.
But you just told us about Neil.
No. Neil got to someone sold me a pair of Lee shorts, the camouflage ones.
So Neil sold you someone else's shorts.
Yeah, to me. I didn't know that was Neil's, and I paid him money for it.
Okay.
And that's why Lee's got a tantrum against me. He's got my shorts on.
Yeah, well, if you're wearing Lee shirts, why?
I wasn't aware at the time. How you find out after Neil went and I wore them yesterday.
And you don't want trading on buying.
Yeah, I won't do that. I won't do that. But even like money's a very valuable what's that word for? Economy. Yeah, basically. And I've learned money management. So sometimes when they say it can be a danger to yourself, it doesn't necessarily mean you're going to hurt yourself, because I never would not. Yeah? And obviously, like, that means some people can use and abuse you because of what you have. I really understand that. And I'm not against anybody else, because, like, one Delhi, I'm sorry to say this, dog, he's very unwell sometimes. Paranoia is horrible, isn't it? That's the paranoia schizophrenia. He's hit me many times, and never hit nobody back. Martin punched me, I didn't hit nobody back, dog.
It's your word.
Yeah, all I'm saying is, I'm not saying,
4 or 5
yeah, sorry, I'm not saying it to myself, dog.
Okay.
I'm not saying to anybody else.
Okay.
I don't see things and I don't hear things.
Okay.
And I've learned money management because I've got kids to feed up, yeah?
Okay.
And all I want is a bit of trust from yourself
Okay.
in terms of like, is going to see my kids today or whatever, whenever you plan it.
Okay.
My death is due on the 28th, but on NHS guidelines, up to your discretion, I can have it today if you want, though. But I don't want to leave yet. I just want, and I'm ready, if you're ready, it's up to your discretion. I can even go right for it, but it's up to you. And I don't mind going on the CPO country.
Okay.
Are you listening to this?
That's
So this medication, dog,
good.
honestly, do you know what scared me last time? You know Dr. Skelton used to work on 34. He's a good doctor, don't get me wrong, yeah? He tried his best on every medication, and I was hard to take watching Tipping Point. I remember Tipping Point, boss. You remember Tipping Point? And the gold star at the end, if you get it off, you get 10 grand, or otherwise you get the money double over. But that's what scared me, but I remember it was going on the depot, because it's in your deltoids now. I don't mind it, it's not discriminative in terms of having it in your glute.
Excuse me, another thing I want to talk about is when having wants to be kind or
But hey, darling.
when you are refusing your medication, you try to speak to nurses in a very.
I don't know. I never, honestly, on my daughter's life, I don't. If the worry is, I say no once, yeah? And they keep harassing me. So I'm like, leave me alone, please, and I go to my room.
So let's be clear about something.
Yes, doctor.
I want to work with you.
I appreciate
I always
it.
want to work with you. But there are some basic things that we're looking to do.
Yes, doctor.
You need to take your medications when they're off.
Yeah, I don't want lorazepam, I don't need it. Can you PR it just for that?
No, you need to take that off. Okay.
No, can you reduce it then?
That's the plan that your company for you, and you not follow that plan in the last one.
No, but I proved myself in terms of if you got Gloria here, or if you had Alan, or if you had Abu Bakr, or if you had Leanne, or if you had Zoe, or if you had certain other patients, not patients, staff in here, that know me better, because I've only met this lady on this section. Other staff know me a long time. Even like Jackie, who's I've known from ECW when this first, I can't tell her daughter's name, but she was a baby and now she's like 14 years. I know Jackie. I've been in the system 16 years now. So, you know, I know 16 years. But 1 year prior to that, I come back from Pakistan and I had psychosis then. And I went to Pakistan and I stayed there for 3 weeks. I come back, started boxing. And I boxed for a year. And then it's on YouTube now, 17 years ago. But I don't want to box anymore, I'm too old. My plan, so I know I'm going a bit far-fetched, but I want to teach kids boxing. And I want to help people like yourself. Not like yourself, but like do stuff like you do, but have a responsibility.
Okay, alright. So, yeah, I get that. All good though. Let's start with the basic thing of the word.
Medication, yeah.
Okay, medication.
I will do that. I will do that. I won't secrete it anymore.
So, I think it will be good to come to the ward and have no incidents where you're not involved in anything.
No, Doc, you don't seem to understand. These cases are trying to pick on me. It's not me going to them, it's them coming to me.
Okay.
And obviously, I'm not one to flight. You know that by now, Doc, innit? So this young lady who I've only met this admission, I want to report it to yourself.
You want to report her?
Yeah, her to you, Doc. Because she come up to me yesterday like this, Alim, why are you being rude to Lee for? I'm like, I've just sat here, I'm not even said off to him today. So some people, but I'll say how it is, they have hidden agendas.
Okay.
Yeah, you know how the system works, innit? And I know how it works as well now, Doc.
Let me just say, when we get feedback, okay, the feedback that we get is a collective view.
Yeah, signed by a clinician or somebody in trust.
That's what I'm saying. It's a collective view of all the people that work here, not just one person there. So the feedback that we have is not just our view, it's the view of the team.
Yeah, okay, so the teams are wrong then. The teams are wrong then.
It's for them to tell us the
Because what it is, Doc, do you know what grooming is? And in terms of like Lee, he grooms every patient that comes in. And when I first come in, he gave me a t-shirt with taxi on it and I said, save for some jeans. And I'm like, fair enough, I still got them. You know what I'm trying to say? And then he gave me £20 with that thing. And I spent £20 back on him and I let him eat the pizza. Yeah, cash, but I spent it back on him. And he ate the pizza, he ate the whole pizza. No, he gave it to me like, oh, welcome sort of thing.
So it was giving you £20 out like.
Yeah, and the jeans, which I still got in the taxi t-shirt, which I wore last round.
Okay. Alright, so we're taking that out because what we don't want is trading or.
I'm not doing it no more, Doc. I got £100 in my account. And I need that, boss. I got £10 cash on me, that's it.
Alright, so
I didn't explain that.
So for me, I'll say, for now, let's just deal with things that they have, not change.
Yeah, I
anything,
appreciate it.
But it will be helpful if you take care of regulations as prescribed.
I will do that, I'm sorry about that. And another thing about the section 17, or if you can do some grounds leave, or wherever you want to work with, I really want to see my kids. And I don't want them to come in here, Doc. Because it's not fair, because Mustafa, he's nice, 6 years old, isn't it? Even Mustafa's like that, you're at hospital, I'm like, oh no, that's trouble, isn't it?
Okay.
I'll leave Richie, Doc, yeah?
Yeah, so what I'm saying right now, we're not changing anything. Let's just look at this week.
Oh no, I can't do that. Because there's only a week of holidays left.
Okay.
And my brother lives next door 247, or even I can go to my other brother's house on Burton Road, and I'm sure you accommodate me. Well, I don't want to go to my mate's yard, I don't want my kids there.
The least we need to see before we are going
Doc, I'll take my medication, yeah.
is take the medication.
I will, Doc, listen, meet me to an acute ward then. I want it today.
It doesn't work like that.
It does work like that, Doc. Because put me on a queue waiting list then and I'll be there gone straight away.
Okay. But right now,
Yeah, I can't do that, I'm not moving from here, I'm sorry then. You have to call your team then, I'm very sorry then. But you know what, listen, you're testing my patience again, Doc. Yeah, and you know like, there's a camera here and obviously you're recorded as well, isn't it? So I take you on the oath, yeah? Anything you don't say won't be given evidence, anything you do say will be given evidence. Because you know what, boss, I say this all the time. We're in the land of God. Yeah, yes, you may speak, you're a young man.
I don't want us to keep making the same
No, you're making a mistake right now. Because you know what, I've missed out 5 weeks of my kids' holidays. Why? Because you want to prove I take my medication. Kathy, I take my medication on road. Simon Shafiq can tell you that, because you know what? When you give aripiprazole 800, which you're not even supposed to start somebody on, yeah? That's breaking guidelines of the NHS. Prometh, obviously, whatever it is, even lorazepam, you can't force it on me. So I'm not taking lorazepam no more. Take off my blood clot charge. I just want to go see my kids, Kathy. Can you speak to this doctor when I leave from here? Please, Kathy Manda. I pray Zeke's alright. And I got the Spider-Man stuff for him. But fucking 8 doctors. Honestly, blood clot God, that fucking 8 doctors. Sorry about that, I'll let you answer that, Kathy.
Okay.
Smoking and what? I'm smoking, it's stressing
Yeah,
me.
you're upset, but it's not just the doctor's decision, is it? It's obviously they've made.
No, they can't listen to this.
Be ready for that, yeah.
Kathy, I'm ready to go home if you have to. Do you know why? Even in PQ, yeah, I'm doing their job for them. Do you get what I'm trying to say? Catch him, look at his face now, look at his face. Red as a plum. But do you get what I'm trying to say, Kathy? I'm not a bad lad. I eat my food, I listen to music. What happened the other day, Lee, what happened? Lee wants to put the smooth radio on. I was outside listening to my music already. And I go, Lee, give me 20 minutes, and then you can put your TV on whatever you want to listen to. He's like white supremacy to me. And I'm like, you what, mate? Now you appreciate what I'm trying to say, what sort of things I have to deal with in PQ. And what sort of, there's always two sides to a story, yeah? Sorry. And I'm positive, and some people are just negative.
No one's saying you're a bad person or anything.
Kathy, I don't need to be in hospital. Do you appreciate what I'm trying to say? I need to get out. I can money manage. I don't want to even be in the system no more. This time, obviously, once I get out, I'm going underground. I won't even see you if this is the way you're treating me. I'm telling you, you won't be able to come to my house. Full stop. I'll be like, get out my yard before I citizen arrest you. Even yourself. Because I'm sick of the way certain people get away with murder nonsense, and other people that just I don't know, might be a bit upset, might be, I don't know, a bit elated, and they get brought in upon depots and CTOs. So you know what, going forward, I'm not having a depot on the 28th, I'm going back on oral. Yeah? That's my decision. As a person of responsibility, who's got responsibility outside, and who's educated to your level, who's experienced stuff in life that you never experienced, and you have to learn off us. So I'm going back on oral then. I'm not going on no CT or no depot. Send me to an acute ward.
So, I mean,
Simon, do you want to add anything? Sorry, Simon. Simon, you muted her. Can you put it back on? Assalamu alaikum, Simon. Can you add anything for me? I'm not taking a depot, Simon. You know I hate it. Fuck, I'm scared of needles. Yeah? No, but listen, I was trying to say, Alex Neve was supposed to be here today. He rang up and they wouldn't let him into ward round. Do you know if I make a phone call, boss, yeah? I pray to God you learn manners. No, not Halim, Mr. Shafiq.
Mr. Shafiq,
Yes, Olu.
do you know what's concerning to me sometimes?
Do you know what's concerned to me about you? You're a forensics doctor, yeah? Listen, you're a forensics doctor. I'm not committed a crime to come in. I should be on an acute ward throughout the whole ordeal. The only thing I did in Chesterfield, I wouldn't let the lady doctor out. I would never say I'd rape you because I've got a daughter at home. And that's why I was trying in seclusion. Then they tried to give me haloperidol fiber, an injection form with promethazine. But I just put some lady come in and give me 2 promethazine tablets. They're trying to ship me out to a forensics one, yeah? But then Sham, who I know very well, she got me in here, Kingfisher. Gabriel come after, he's like, Aline, I'll try to stop you from going, but there isn't the paperwork. Do you get what I'm trying to say? I make good people wherever I go. And Kathy, if your heart's in the right place, which I hope it is, yeah? I want to change my CPM as well. That's my discretion. You can fuck off.
Okay, so, Aline,
Honest God, you can fuck off from now on. You're not coming to my house. Enjoy your new car and stuff. Piss off. Simple.
I think we should...
Get the fuck out of my life. I'm going back to Jenny. I'm good, I'm blessed.
You're angry right now.
I'm not angry. How do you know I'm angry? I talk the way I feel.
Okay.
If I was angry, you know, I could jump over the table and I can deal with you in like a second. I'm not angry, so don't never say that. Never direct your negativity to something positive.
you're not hungry, but this behavior is not acceptable.
Yeah, but your behaviour is not acceptable sometimes. Okay, let me give you an example. Yeah, before I go, Dijan, Simon, last time punched me, yeah? Tammy comes out, goes to limbo seclusion and kills you. Penny comes out, give me lorazepam, I go to my room. This young man, he burnt Radbourne's room, yeah? And then he come here and he sent him home for Christmas because he's going in for Class A drugs and making bombs into Nottingham prison. And he let that young man out just so he could go spend home with his family and stop. Now you get what I'm trying to say. And Denzel, he fucking threatened me many times. Remember that time he rang Penny and she wouldn't answer the phone? Yeah, Denzel's in Chaddisden, he's in for paranoid schizophrenia. I don't even know if he's on a depot. He's not on a depot no more. He was even on CGO. Sorry. I want to go. Listen, I want to go to an acute ward then if I'm staying here. I'm acute ward ready. I shouldn't even be here because last time you guys had him on the CGO. Do you remember you young man me?
So,
Yeah, and Dr. Ali, he said no CTO for this young man because he doesn't need it because he's a psychiatrist. He's not a forensics doctor. I don't need to be involved. I'm not committed a crime to come in, young man. That's what you don't seem to understand.
okay. Should we do that?
Yeah, thank you for your time. Simon, like I say, Simon, depot or whatever, I'm not going on an injection when I get out of here. So you need to titrate me back across to oral. Because I take my oral medication, Simon, you stop telling lies just because your family are worried about it. And Kathy, I don't want you in my CPN no more. Fuck off. Simple.
Alright, thank you very much. We can close now. Okay?
No, you can't. You're going to talk to these lot, but obviously it's up to you, Simon. Like I say, you can sign up for section anytime you want. I wrote to the hospital managers meeting. I'll speak to Zoe right now. If you don't get me out, I'll get myself out. Can I get some grants, please, Doc? Because I got no vapes, and I got cash. I need to go, and I want to go have a full English breakfast.
I think the water on his phone.
Yes, I know. No, you can't. No, I've asked for it before. Doc, can you write everything down? Haven't you? Yeah, God bless you for your time, Doc. I don't like working with men. Because you know, men think with their cocks, the pricks, the thorns. Ladies think with their hearts. I think women should run countries. And Kathy, piss off. Honestly, God, piss off if I am. You racist cunt. God bless you for your time. Thank you. Fuck off. Give my fucking, give my Gruffalo teddy bears back. Hi Jane, you're right. James, you know that manager's thing, yeah? The manager's meeting thing, did you hand it in? How come I not got a reply yet then? I don't want Kathy as my CPN no more. Is Zoe here today? Oh, okay then. I'm missing out on a lot of holidays from kids, you know. I've got a lot of work to do outside this. I don't want to be on benefits my whole life. You get what I'm trying to say? You know, I'm an able man, and I want to go back onto oral, by the way. I'm not taking a depot. We're gonna have problems. You hand it over, please, yeah? Thank you, darling. You alright, Morgan? You alright, Mum? I don't like that one. He's a knobhead. It's alright, man. Yeah, man. Kathy's not my CPN anymore. Peace, jeez, I'm out.